Welcome to Adapting Class, home of content simplicity, where we make content easy. 10 congenital heart questions that we're going to practice. I'm not going to let you memorize content, but I want to show you the logic, how to approach this kind of questions that show up on the NCLEX and nursing school. We're going to use test-taking strategy to approach this question. Are you ready? Let's get to it. And if this video helps you, click on the like button and share it, and subscribe to Adapting Class for content simplicity. The first question is on what? Ventricular septal defect. What is the question asking you? How do you approach this question? Read it from the back, and then you monitor for which complication. The buzzword and the keyword is what? Monitor for complication. Then you read the first portion of the question. A newborn is diagnosed with what? VSD, ventricular septal defect. What should the nurse monitor for? Decreased pulmonary blood flow, right to left shunt, congestive heart failure, or what? Cyanosis at birth. Pause the video, try to answer it on your own, and then listen to the way how we're going to approach it. I'm going to give you a few seconds. What do you think? What should be the answer? You got the answer already? Let me know. Put down in the comment and let me know what you selected. But let's think about it. Let's break it down. Let's use logic. See the way I'm going to approach it. The first thing I'm going to ask myself, what is VSD? VSD is one of the defects. It's a hole in the heart, right? It's the hole between the two ventricles. What happened to VSD? Ventricular septal defect leads to what? Left to right shunt, because the left side is stronger than the right side. So if blood is moving from the left to the right, what is happening? Blood is staying in the heart. Blood from the left side is already oxygenated. Therefore, what do you think? All this blood is going back to the lung. So this is what we have. A left to right shunt, increasing blood flow in the heart, and the blood is going back to the lung. Do you expect a left to right shunt to cause cyanosis at birth? No, because the blood is already oxygenated. Do you expect a right to left shunt in the something that I already said is the right to left shunt? This is wrong. If more blood is going to the right ventricle, therefore, what is going to happen? More blood go to the lung. There is not going to be decreased pulmonary blood flow. Therefore, what is going to happen? More blood stay in the heart, and you have what? Congestive heart failure. This is the way you break down the question. VSD, ventricular septal defect, leads to what? Left to right shunt. There's more blood going to the what? The heart, and you have congestive heart failure. Therefore, our right answer is number 3. How do you think about it? Look at the way we break the question. Each of these questions, we're going to do that. Some of the questions may be hard. I'm going to take you up and down, but we're going to use logic. We're going to use content simplicity to make sure we can understand this, so that when you finish watching this video, any questions on congenital heart defect become easy. Use the same approach. Number 2, same thing. We're going to read the question from the back, which finding indicate the nurse should what? Intervene immediately. I'm going to go for my buzzword. There's one word I need to intervene immediately. This is a prioritization. They ask yourself, what are they talking about? A 2-year-old, right? 2-year-old child returns to the unit after what? Tetralogy of Fallot repair. If you don't know what is tetralogy of Fallot, it's a heart surgery. Just tell yourself, I just have heart surgery, a 2-year-old. What is the issue? Which one should you intervene? Incisional pain, heart rate of 110, the peripheral edema and hepatomegaly, oxygen saturation of 95. Ask yourself, think about it. We already know tetralogy of Fallot is a cyanotic heart defect. That means the kids are blue. They have TET spell, so the kid is already blue. He just had surgery. We're trying to repair what? The tetralogy of Fallot. There's 4 components, and we're trying to repair it. What do you think? Look at the last question. Once again, stop the video, try to answer it yourself, and then listen to the way I'm approaching it. Pause the video. I want you to pause it and try each one of them. Now let's break it down. I know tetralogy of Fallot, they usually cyanotic. Look at number 4. Oxygen saturation of 95 on room air. I don't think so. That's not a bad thing. I don't even expect them to get to 95. They've had surgery, they had surgery, the saturation is 95 on room air. That is a good thing. You have a heart surgery, you're going to have pain. Heart rate of 110 is normal for a 2-year-old kid who just had surgery. Then why is number 3 the right answer? Think about it. Think about it carefully. When they had surgery, peripheral edema, and hepatomegaly, you expect the heart to what? Start working, right? If the heart is not working, what is going to happen? Blood flow is going to decrease. What is happening? When you see edema and when you see peripheral edema and then liver enlargement, it means blood is backing up towards the right side. So we have heart failure associated with the right side. This is common in tetralogy of Fallot repair or any heart surgery. Therefore, number 3 is your right answer. Number 3, what is your score? Put down in the comment. Let's break this question down. We're making content simple as much as possible. What is the next first action? That means number 1 thing she's going to do. A 2-year-old child with what? Tetralogy of Fallot, because I'm going to talk about things the NCLEX is going to ask you. There's a 2-year-old. That's the reason why I give you age. There's a tetralogy of Fallot. It's a kid. He's squatting. You see what I'm going through? I'm breaking down the question. I'm not just reading it just like that, trying to figure out what they're asking me. Drawing hypercyanotic episode. What am I going to do if I'm the nurse? Administer oxygen, place the child in the knee to chest position, calm the child down or give them morphine or notify the provider. I'll give you a few seconds. Think about the answer and put it down in the comments. Let me know. Put number 3. This was my answer. What do you think? Now let's get to it. Let's break it down logically, right? The tetralogy of Fallot. We already know there's 4 things that happen. The kid is going to have third spell. That's what is happening. And what is third spell? There is pulmonary spasm, the pulmonary stenosis. There's 4 components of tetralogy of Fallot. We have VSD, right heart hypertrophy, and an overriding aorta. The problem with the third spell or hypercyanotic episode is due to what? Pulmonary stenosis. This go into spasm. Now, if I'm in spasm, there's no blood going to the lung again. We have blood shunting to the left side. So you have right to left shunt. There is more shunting. The only way you can break the shunting is to increase your blood pressure, increase systemic vascular resistance. How do they do that? This is why we put the kids in the what? Knee to chest position or squatting position if it's a kid, or we swallow the kid. Look at the question. A 2-year-old is already squatting. That means he's in what? Knee to chest position. Don't pick that answer. It's a trap. The kid is already squatting. He's in knee to chest position. Oxygen is not going to improve oxygenation because we want blood to go to the heart, because we want blood to go to the lung. If you notify the healthcare provider, it's too late. Therefore, we need to calm the kid down or give them something that will calm down, that will prevent the shunting. It will decrease oxygen demand. It will decrease the spasm of the pulmonary stenosis, and more blood go to the lung. This is the way you treat patients with third spell. So the way I want to remember them, position is number 1. If it's an adult who can squat, good. is already squatting, which is the same thing as knee to chest position. The virus is not necessary because we know the kid is blue. Therefore, we should calm the kid down, give them oxygen before we notify the provider. Number 3 is the right answer. If you get this wrong, it's okay. We're learning, but this is the logical way, using buzzwords, looking at each other questions and figure out what is in the question that I've given you to answer it. You may have seen this question before that everybody say knee to chest position, but you have to look at what you've been given. Number 4, a preterm neonate is diagnosed with what? PDA, patent ductus arteriosus. Which clinical findings should the net expect, right? Harsh systolic murmur at the left sternal border, machine-like murmur at the left upper sternal border, cyanosis of the lips and nail bed, and bradycardia. Once again, approach the way I read the question, read it from the back, pause the video, attempt to break down the buzzword in each of the question, attempt to break down the buzzword in this question stem, and look at the answer and bring your content and use it to analyze it. So that's what we're going to do. What are we being asked? Like I said, put down your answer choice, pause the video, and do that. But what are we asking? Expected finding about what? PDA. Therefore, if you need more content, I will link a bunch of congenital heart disease videos to this so that you can read about them. But what is PDA? PDA is a connection that when this is your heart, we have the pulmonary artery and the aorta. When the kid is inside the mommy, we call it Ductus arteriosus. Baby lung is not developed. Blood is being shunned from the right side to the left using the Ductus arteriosus. When the baby gets born, it's supposed to close. If it doesn't close, it remains patent. That's what we call PDA. Therefore, a PDA means patent ductus arteriosus. Because the left side is stronger, when the baby is born, blood is now shunting from the left to the right. So this becomes a left to right shunt. A left to right shunt, you know, baby is not going to get blue. They are not cyanotic. Therefore, number 3 is wrong. They're not going to be bradycardic. They're going to be tachycardic because of a bunch of blood flow going to the heart. Now you want to know where the murmur is located. Because there is a connection between these two vessels, blood is flowing whether you like it or not, whether we have in systole or diastole. And it's like a machine that keeps on pumping blood no matter what. And this is why it cannot be harsh systolic murmur on the left lower sternal border, because this is only specific to systolic, and that's the location is inappropriate. This is what we call VSD. This become machine-like murmur. And so how do you remember it? What is the mnemonic? PDA causes a continuous heart murmur. And this is number 2. Number 2 is the right answer. Next question. Number 5, we are halfway. A 3-year-old child with the ASD is being assessed. Which sign will be most indicative of a defect? The same thing. What kind of information will you know about ASD, which is atrial septal defect? Do you hear loud systolic murmur at the pulmonary area? Do you hear a bounding peripheral pulses? Do you have a diastolic murmur at the apex and the clapping of the fingers? Once again, break down the content, stop the video. You have to know what ASD. ASD is between the two atrium. We have the right atrium and the left atrium. That means there's a connection between them, right? So that's number 1. Blood is flowing from one direction, mostly from the right, mostly from the left to the right. That's how the blood is flowing. And the way to remember what kind of information you will see is what? Is the oxygenated blood going back to what? The long, and therefore they don't have clubbing of the fingers. They are not going to be blue. Second, bounding peripheral process, it has nothing to do with the process. When you have peripheral process bounding, this is coarctation of the aorta. That's wrong. Now we left with 1 and 3. This is how you can use test taking strategy. Look at the location, right? I told you the right atrium and the left atrium are connected. They are not at the apex. Apex is here. But that is another way to see it. But there's another way to know about the mnemonic, how to remember whether atrial septal defect is a systolic murmur or not. And this is the way I call it. I call it what? A systolic defect. ASD is a systolic defect. So it's a systolic murmur. But as you can see, it's between the two atrium. The location is not going to be consistent with what? Apex. Secondly, when the blood moves from the left side to the right side, it's going to go to the lung. We have more blood going to the pulmonary artery, and this causes systolic murmur based on the location and the pulmonary area. You have more blood flowing to that area. So that's why that's the right answer. Number 1 is the right answer. This is the way you can break most of these questions. They are a little bit intimidating, but you got to use the pathophysiology and logic. Which findings supported diagnosis, same thing. And then assesses a newborn with suspected coarctation of the aorta. What do you expect? A weak and absent peripheral pulses, cyanosis of the upper body, decreased blood pressure in the arm, and machine-like murmur. Once again, stop the video, put down your answer in the comment. I'm going to give you a few seconds. Which findings support the diagnosis? Something support. I'm going to underline support. And then I ask myself, and then assessing a newborn with what? Coarctation of the aorta. I have to know what it is. And I said, what? What is that? What is coarctation of the aorta? This is the content. I want you to write it down. I'm going to use some strategy. First, we got to know our anatomy. The heart has blood flow coming out. The aorta branches, you go to your leg, and then some go into the upper extremities. Before it goes to the leg, there's obstruction here. So this is being pinched. But the one going to your upper extremities, your head, is okay. There's no pinching. There's no blockage. This is where the blockage is located. Coarctation is constriction. So there's a constriction here. Therefore, you should expect blood going to your upper extremities is easy. When it's going to the lower extremities, it's going to be tough. Therefore, more blood go to your head and your upper extremities, and less blood go from the lower extremity. This is coarctation of the aorta. Therefore, what do you think? Do you expect weak and absent femoral pulses? Do you expect cyanosis of the upper body? Do you expect decreased blood pressure in the arm? Or do you expect machine-like murmur? We already seen that this is what machine-like murmur is, a PDA, so it's gone. We know your blood pressure in the upper extremities is going to be high. Therefore, the upper arm pressure is not going to decrease. We know this is not going to be cyanotic. We know that because there's more blood going to the upper extremities, they're not going to get blue in the upper extremities. Therefore, test taking strategy, weak absent peripheral pulses is what you should expect. Therefore, weak absent femoral pulses is what you should expect. And therefore, how do you master them? Coarctation means narrowing. The aortic narrowing occurs after the blood goes to your upper extremities. And therefore, the key thing I want you to remember, blood pressure in your upper extremities is high, and blood pressure in the lower is low. Therefore, number 1 is the right answer. Number 7, which is most important for the nurse to teach? What are you going to teach? Parent asks about signs of congenital heart disease worsening in an infant at home. That means, what do you think if you have a heart problem, whether you have left to right, right to left shunt, what would tell you your congenital heart disease is worsening. You turning blue when you cry, persistent poor feeding and lethargy, mild sweating with feeding, and slight weight loss over 1 week. Of course, most people with congenital heart disease, they have what? Hyperdynamic states. Because of CHF, their metabolic rate increases, they can lose weight. They can sweat when they feed them. They may turn blue when you feed them. But if they cannot feed and they have lethargy, this is a sign of CHF. And therefore, that's your right answer. This is the content I want to give it to you. Now, I want you to try this. This is VSD, ventricular septal defect question. We're talking about congenital heart disease using English practice question and answers and using content breakdown. What do you think? Watch the video, answer this one. Which statement indicate the parent understand the condition? The nurse is teaching the parent of a child with the word small VSD. When you see questions like that, there's a reason why there's a word small in front of it. Don't panic. Don't think they're tricking you. They said small. A VSD is what? Put it down, your content. That's what you need to answer the question. Now look at the answers. My child will need immediate surgery within the first week of life. Some small VSD may close spontaneously as child's grow. Our child will likely develop cyanosis in life. Activity should be restricted, limited to prevent complication. Watch the video, try it, and put down your answer in the comment section. I invite you, question number 8, put hashtag number 8 and select what? What do you think? It's a VSD. VSD, what does they do? It's a left to right shunt. The kid is not going to be blue. Therefore, you can definitely see number 3 is wrong. If I'm not going to be cyanotic, why would you limit my activity? Number 4 is wrong. If I'm not going to be cyanotic, I don't need surgery right away. Number 1 is wrong. All you left with is what? 2. We are using logic, content simplicity, sometimes apply some common sense and say what? This is the way we approach questions, test-taking strategy, English practice question. And therefore, number 2 is our right answer. Blood is being shunted from the left to the right. Number 9. This may be difficult because of the words, but don't worry. Content simplicity is all we need. It's a word in the question that may freak you out, but don't worry. Adapt English got you. Which intervention is a priority while awaiting surgery? Buzzword means awaiting surgery. A newborn with transposition of great arteries presents with what? Cyanosis shortly after birth. I've given you a clue. Baby is blue right after birth. That tells you it's a congenital heart defect. If you turn blue right after birth, it has to be what? A right to left shunt. That's all you need. That's all you need. This is the way you simplify content. Even though you don't know TGA is okay, transposition of great arteries. What would you do? Antibiotic, prostaglandin, encourage breastfeeding, give them digoxin. They are waiting for surgery. Why are they going to surgery? Something is wrong. They're turning blue right away because it's a right to left shunt. What would you prioritize? Then you said, I don't know what is TGA. It's fine. I'm going to give you a content. I want you to write it down. It's a transposition of great arteries. There's 2 great arteries. Normally, you have the pulmonary artery is on the right side and the aorta is on the left side. When there is transposition, you have the aorta coming to the right side and the pulmonary artery going to the left side. Pulmonary artery, what does it do? It sends blood to the lung. The aorta sends blood to the rest of the body. Therefore, if the aorta now is on the right side, it's sending deoxygenated blood. There's no blood oxygen in that blood going to your body. You're going to turn blue. That's why you're cyanotic. That's a problem. Baby cannot survive. All blood going outside is blue. We got to fix it. How do we fix it? That is the key. And that is the key thing I want you to forget. I don't want you to forget. And this is the mnemonic I want you to use. Most of the cyanotic heart disease, they start with the T. And the most important thing they need is what? Connection, something that will send blood back to the lung. And what is that? If we have a PDA here, that will be great. If we have a PDA, it will shunt blood from the left side to the right side, and this can go to the lung, and the baby will live. And therefore, what is the strategy to answer this question? This is my mnemonic. Prostaglandin keeps the ductus arteriosus open. The ductus arteriosus will remain open. It shunts the blood between the pulmonary and the aorta, and baby will remain what? Not blue, and it can survive. Therefore, know this mnemonic. Write it down. TGA means totally got to keep the ductus arteriosus open. Then this will allow blood to flow between the pulmonary artery and the aorta. The TGA is not good for life. Transposition of great arteries. And therefore, we need to keep the ductus arteriosus. Ductus arteriosus remain open when you have prostaglandins. If you are born and your ductus arteriosus open, that is PDA, we give you NSAID. If you want to keep it open, you give them prostaglandins. That's why number 2 is the right answer. This is the hard one, but that's the strategy. Next question. A child returned from surgery for VSD repair. Which finding require immediate notification of the provider? Stop the video. Once again, don't worry. VSD is a heart surgery. Therefore, look at the answer choices that shows patients doing bad. Capillary refill of 2 seconds, heart rate of 110, a new heart murmur, and decreased urine output, incisional pain. What do you think? What do you think? Question number 10. I know you got it. 10 out of 10. Look, incisional pain, unexpected finding. Capillary refill 2 seconds. That's better. Blood flow is good. Heart rate of 110. Mr. Child, it's okay. A heart murmur means the repair did not work. Decreased urine output, heart failure. Therefore, we got to do something about it. 10 questions. English practice question. Congenital heart defect, congenital heart disease. We're breaking down all the anomaly, VSD, ASD, PDA, transposition of the great vessels, tetralogy of Fallot, and how to approach these questions using logic, content simplicity, trying to simplify this hard information. If this video helped you, put down in the comment and let me know. And click on the like button and share it with your friends. Thank you for watching. If you need more content simplicity, subscribe to Adapt and NCLEX. Thank you for watching. All the best of luck. Bye.